Welcome back. There are changes every day in regards to this pandemic, but one industry that continues to take a hit is the economy. This morning, we are talking with Mike Bertaut. He's a healthcare economist and Straight Talk blog author from Blue Cross and Blue Shield of Louisiana. He's here to talk about this economic outlook and what we all can do to help get these businesses back open. Welcome back to the show, Mike.
Thank you so much, Malik, and good morning to you and all of your listeners.
Good morning to you, and I'll say it now. Go Tigers. I can see we have an LSU fan in the house today. Now, let's talk about, unfortunately, what's happening with these businesses right now.
Yeah.
So many businesses have been impacted by this coronavirus. We see it on the news every day. But tell me about the oil and gas industry, because it's kind of like a double whammy for them, right?
Yeah, that's exactly right. What we saw happen in the spring was sort of a war between Russia and Saudi Arabia to see who could dump the most crude oil onto the marketplace. And so when this glut of oil hit in March and in April, it started to suppress the prices. At the exact same time, COVID-19 forced people to lower demand. And so all of a sudden, you've got less demand for oil and a lot more oil on the market, and the price plummeted. We got into the teens for a barrel of West Texas Intermediate crude, which we would expect to trade normally in the $50 range. In fact, the state's economy was based on a $59 barrel of oil when they did their estimates back last year. And if you want to see drilling and production kick back up, and fracking start again, for example, we really need that oil to get back into that $50 range and hang out there for a while. But it hasn't happened so far.
It's really interesting because, this is an industry that affects all of us, right? We all have to fill up cars and stuff like that. So we need these industries. We are hoping the best for the oil and gas industry. Now, how do we get, how do we get this economy back up and running? What are some tips that you have for us in your professional opinion?
The economy was in very good shape prior to COVID-19. Unemployment was super low. Everything was really good. But essentially, we had to close down large swaths of the industry to protect the hospital system because we didn't want to become overwhelmed with patients in ICU beds or patients that were, taking up more and more hospital beds. We didn't really understand COVID that well at first and was still learning. So the important thing to remember right now is we don't have to reinvent the wheel to get our economy back online. Just look across the ocean to Europe, and what you see there is a union of countries 50% bigger than the United States in terms of population. They have 50% more people than us. We're rocking 60, 70,000 COVID cases a day. They're turning up 3 or 4,000 in 446 million people. How are they doing it? It's not rocket science. They're wearing masks. They're doing the face covering just like we're supposed to do here. They're doing social distancing there. They say, hey, 2 or 3 meters away from each other, which is about 6.5 to 10 feet apart for their social distancing. They promote what's called enhanced hygiene. Wash your hands more often, just like here. Don't touch your face. And if you can check your temperature every day, go ahead and do that. If you see it elevating above 100, stay home. Stay away from other people and don't spread it around.
But I know for a lot of people right now, we see a lot of people, unemployed right now. And for me, I'm thinking, oh my goodness, what is happening to their health insurance? What can you tell us about people who may be losing their health coverage?
That's a great point, Malik. And the first thing I want to say to y'all out there is do not panic. If your job furloughs you or you lose your job and you get that COBRA notice in the mail that says your health insurance was $100 a week contribution and now it's $800 a month, don't panic, because if it's unaffordable for you, you can go to healthcare.gov and they'll qualify you for whatever federal program is available. When you get on healthcare.gov, they'll screen you for Medicaid. If you've actually lost your coverage at work, they'll trigger a special enrollment just for you for 60 days so that you can enroll in private insurance with federal assistance. You won't have to pay, in most cases, 100% of the bill by yourself. If you're over 65, it'll trigger a special enrollment for Medicare. You can enroll in Medicare Advantage. You might be able to get a short-term insurance plan as well if you're relatively healthy, and those can be half the price of other types of insurance. But just remember, your job is legally obligated to offer you COBRA if you had insurance before, but you are not legally obligated to accept the deal. You can move on to healthcare.gov. You can try to get into Medicaid. You can get something you can afford.
The right
Louisiana's
stuff is still
safety net
there.
on health insurance has never been better than it is right now.
That is great to know because I know some people who have lost their jobs due to coronavirus and they're
Yep.
afraid. But luckily, now they have some information there. Thank you so much for joining us this morning, Mike. You are the bomb. He is the author of a blog called Straight Talk. If you want more information, please go ahead and visit that website, straighttalkla.com. Lots of great resources on there. And of course, Blue Cross and Blue Shield has all the up to date information about COVID 19 and businesses reopening on their website. Just visit bcbsla.com/COVID-19.